Now, Ottawa is one of these cities that's proving to be particularly successful at reducing its COVID-19 case count and keeping it relatively low. For example, in mid-October, just a few weeks ago, Ottawa was recording about 132 active cases per 100,000 residents. That's among the highest in Canada. And that number now sits at just over 29 per 100,000. To figure out how they did this, I'm joined now by Dr. Doug Manuel. He's an epidemiologist at the Ottawa Hospital, joining us now. Hi, Dr. Manuel. Thank you so much for joining us.
It's my pleasure.
Okay, Dr. Manuel, you're in Ottawa, where things seem to be going pretty great, and we're here in a lockdown Toronto. So what did you guys do right that we haven't figured out yet?
Well, the Ottawa person in me feels proud, but the scientist in me says it could just be a fluke. Yes, statistical. We're so far out from the normal right now, but I think it is. We're building the book as we go around the world about how to fight these pandemics, and there are, I think, some signals that we're talking about at the science tables that Ottawa's doing that maybe others aren't doing as much. I think those are the classic things like leadership, innovation, paying attention to your social norms, really being local, like really doing your focus groups, listening to your 311 calls and your website, and using that to get the message out to folks. So there are some signals here that are favorable for Ottawa.
When you mention things like leadership and innovation, can you be specific? What is the leadership that's working? What's the innovation that's working in Ottawa?
Well, I think leadership, Dr. Vera Etches, she's our medical officer of health here, and a few weeks ago she wrote a letter to the mayor. Well, a lot of things, like I think they're communicating really well. Look at the Twitter feed for them, like just how they're messaging and keeping people going. But she wrote a letter to the mayor that really filled in that level of specificity that we need in Ottawa, saying, we've seen outbreaks in our sporting events. Don't only think about the outbreak, or don't only think about the event, but how you're getting there. Are you driving with masks? Are you driving kids with masks? Are you socializing afterwards? And that's being fueled by a lot of those deep investigations about where we're seeing cracks. So I think really filling that in. Innovation, in the spring, Dr. Taha, he's Associate Medical Officer of Health in the Ottawa Public Health, was working with the engineers about wastewater testing. Like we're talking back in April. Now Ottawa is the only municipality that is reporting wastewater testing in the country. It's going to spring up everywhere. So being first, being innovative, even when the evidence isn't confirmed yet, make the evidence and incorporate it into your practice.
What is the story with the wastewater testing? How is that improving your COVID-19 rates?
It's not necessarily improving the rates. It's giving us more information. And it's reducing our decision uncertainty. So the hospital CEOs, the mayor, public health are all looking at the tracing for wastewater. It's been coming down. And that gives business communities feedback. It gives people feedback about how we're doing. And because we can't rely on one piece of information, cases, hospitalizations are a little bit fuzzy. So we're adding more information, giving the population a sense of how we're doing. And that's that feedback loop. That's really, I think, being appreciated by a lot of folks in Ottawa.
Dr. Manuel, one of the big issues that's of light right now, of course, is the vaccine. When is it going to get approved? When is it going to get distributed? But once it is here in Canada, should it become mandatory for all hospital workers? Maybe that's off my job class and more for the ethicists. It's interesting, in public health, our principle is to do the least intrusive as possible. To be honest, for hospital workers, I don't think it's going to need to be mandatory, but we have had that debate previously with things like influenza vaccination. I think we're going to find that the uptake's good, and I think we won't be having this discussion, but we'll see. And finally, before I let you go, any words of advice for the rest of the country where the numbers are far, far higher than what you're seeing in Ottawa?
Well, they're going to keep on going up unless things change. So it's a question, like what we did in Ottawa, which was great, is that their change happened when things weren't really high, when there were about 100 cases per million, 150 cases per million, like you talked about. So you're going to have to change at some point, or they're going to keep on going up. And so think about what you need to change to bring that transmission down to that R naught, at RT less than 1, get into negative growth. And then we can't, like in Ottawa and everywhere, you can't look sideways to COVID. It's just such a fast, silent spreader that we're going to need to get into something comfortable for the rest of the winter with sort of negative or low transmission.
Okay. Dr. Manuel, thank you so much for your time, sir.
My pleasure.
Dr. Doug Manuel is an epidemiologist at the Ottawa Hospital.